Hello friends, welcome to Batch Pathology, and today we will continue our lecture on hypertension. This is our second lecture on hypertension. In first lecture we looked about meaning and definition of hypertension, what is normal, what is abnormal numbers, different stages of hypertension, and then we look about classification of hypertension, that is primary and secondary. We also looked at most of the cases of hypertension are of primary type, that is also called as essential, and only a little cases are of secondary type. And again we saw that both this primary and secondary hypertension may be benign and malignant. Benign one is a generally you can say that it is a misnomer, because there is nothing that can be called as benign hypertension. Every hypertension is evil, every hypertension is risky, every hypertension can cause disease and death. So there is nothing really that can be called as benign hypertension, but it is an old term which is still being used today by some authors. So for study sake, we know that both primary and secondary hypertension can be termed as benign or malignant. So benign means gentle and malignant means evil, but this term is misnomer. Now we will start with our today's lecture, that is lecture number 2 on hypertension, and we will look at etiology and pathogenesis of hypertension. So first of all, you should remember that blood pressure means force of blood pushing against the walls of the arteries. Blood pressure means force of blood pushing against the walls of the arteries, and if this force is increased, it is called as hypertension. Okay, so blood pressure is a force of blood that pushes against wall of the arteries, and obviously if this force is increased, it is called as hypertension, because hyper means above normal. So question comes to our mind naturally that which things can increase this force, and there are two things that can increase this force. Those are cardiac output and total peripheral vascular resistance. So now we will look at what is cardiac output and how it affects the blood pressure. So cardiac output is the amount of blood that heart pumps in 1 minute. Cardiac output is the amount of blood the heart pumps in 1 minute. So obviously if cardiac output is increased, that is heart is pumping more amount of blood in 1 minute, then it will lead to increase in blood pressure. You can understand this by example of a pipe which is carrying water. So if you pass 1 liter of water in 1 minute through that pipe, and if you pass 10 liter of water in 1 minute through that pipe, then obviously you can guess in which case the pressure will be more, because time duration is same in both. There are time duration is 1 minute in both cases, but in first case there is only 1 liter of water is passing, and in second case 10 liter of water is passing. So obviously if 10 liter is passing through in same time, then the pressure is increased in that case. So similar is the case with heart, that if heart is pumping more blood in same amount of time, amount of blood is increased, but time is constant, so it will lead to increase in blood pressure. So this is cardiac output and its effect on blood pressure. Now we will come to second point, that is total peripheral vascular resistance and how it affects blood pressure. Peripheral vascular resistance means resistance of arteries to blood flow. Obviously there is again if you take an example of pipe, then water passing through it will feel some resistance due to pipe. So that is the case here, that blood passes through arteries, and these arteries have put some pressure on or rather resistance on flow of blood. So that is called as peripheral vascular resistance. And in that case, if blood vessels constrict, if those arteries constrict, it will increase blood pressure, because now same amount of blood will have to pass through a smaller opening. So if there is opening of 2 feet and two people are passing, they will pass easily. but if that opening is reduced to 1 feet and again two people are passing, they will push against each other and the pressure will increase. So this example you can understand that if blood vessels constrict, it will increase blood pressure. Now, in addition to these two mechanisms, there is one third mechanism also, which has a very important role in hypertension. That is kidney. Kidney also has an important role in hypertension through renin-angiotensin system. And what is this renin-angiotensin system? We will look later. Basically, the kidney has an important role in secondary hypertension. Kidney has important role in not primary but secondary hypertension, because in that case we know the cause of hypertension, that is kidney, so it is responsible for secondary hypertension. Now we will look at the mechanism of two form of hypertension separately, that is primary and secondary hypertension. So first of all we will start it primary hypertension. So in development of primary hypertension, many things are proposed, like genetic. First one is genetic factor, and there are many evidence which support involvement of genetic factors in primary hypertension, like familial aggregation. What is familial aggregation? This means clustering of disease in a family. And what does this means? That many cases of hypertension are found in same family. Like if father is hypertensive, his offsprings will be hypertensive, his brother may be hypertensive. So many cases of hypertension are found in one family, that is called as familial aggregation. And again second point is occurrence of hypertension in twins. So if one brother or one sibling is suffering from hypertension in twin, then other twin most of the time he also suffer from hypertension. And then there is epidemiological studies, those found that hypertension runs in families, and experimental animal studies. And last one, the most important one, is identification of hypertension susceptibility gene. So this is a gene called as angiotensinogen gene, which is found which is commonly found in people with hypertension. So it is suspected that if these genes is present in somebody, he will suffer from hypertension at some point. So this was genetic factors. Now coming to racial and environmental factors. So in studies done in USA, this is found that black people are more susceptible to hypertension than white people. So there is obviously some racial factors are involved. And in environmental factors, environmental factors means the things which we come in contact with are called as environmental factors. So increased salt intake, obesity, skilled occupation, higher living standards, and individuals under high stress, all these things are linked with hypertension. Because skilled occupation, why? Because in skilled occupation there is a high stress level. And higher living standards, because it is closely linked with increased calorie intake. So more the calorie intake, the more will be chances of atherosclerosis, etc., which contribute to hypertension. Third one is risk factors modifying the course of essential hypertension. So basically this is not a causative factor for hypertension, but if hypertension is present, then these factors modify the course. What does mean? That these factors may worsen the prognosis, or they may worsen or they may better the prognosis of hypertension. So what are these factors? First one is age. Younger at the age at which hypertension is first noted but left untreated, lower the life expectancy. What does this means? This means that if take the example of two persons, first one is 20 years old and second one is 30 years old, and both are diagnosed with hypertension. So the person and both are not treated, just diagnosed. So the person who is 20 years old will have lesser life expectancy because he is diagnosed with hypertension earlier. So this is age factor modifying the course of essential hypertension. Second one is sex or gender, that is females with hypertension appear to do better than males. That means all other things equal, if a male and female have hypertension, then male will be affected more. His prognosis will be worse than female. Third one is atherosclerosis, and atherosclerosis invariably accompanies essential hypertension. That means if a person has hypertension, he will certainly also have atherosclerosis, and atherosclerosis will worsen the prognosis of hypertension. And there are then some other factors also which modify the course. Those are smoking, excess of alcohol intake, diabetes mellitus, persistently high diastolic pressure above normal, and evidence of end organ damage like heart, eyes, kidneys, and nervous system. What is end organ damage? End organ damage means end organs are those organs which are last in the series of something like something bad happening, something damaging happening, like if there is plaque formation in blood vessels or coronary arteries, then first coronary arteries will suffer, but then ultimately heart muscle will suffer because their blood supply will be stopped and they will be necrosed. So here heart is end organ because it is the last one to suffer damage in a chain of events. So the last organ which suffers damage in the chain of events is called as end organ. Now pathogenesis of primary hypertension. So there are many theories which explain pathogenesis, and we will just look at their names because it is out of scope to study about them. Those are high plasma level of catecholamines, increase in blood volume, increased cardiac output, and then there are two more, that is low renin essential hypertension and high renin essential hypertension. So low renin essential hypertension is found in approximately 20% of the patients, and it is due to altered responsiveness to renin release. And high renin essential hypertension is seen in about 15% of cases, and it is due to decreased adrenal responsiveness to angiotensin 2. So this completes our today's lecture, and we have looked at mechanism of primary hypertension. In next lecture we will look at mechanism of secondary hypertension. I hope you enjoyed this lecture, and if anything is not clear, you can ask in comment section. Take care.